This event is being brought to you by the Brockton Area Branch, NAACP, and Family and Community Resources. Can you speak to some of the intersections of intimate partner violence and mental health for the Black and BIPOC community?
Productivity at school and work, being a caregiver, your mental health. If that's not working correctly, you can't function and care for someone else correctly. Engaging in healthy relationships, or even adapting to change. Those things are hard when your mental health is jacked up. And you're dealing with as I said, domestic violence at home.
Restraining orders aren't the safe avenue for every person. Folks don't have, not everyone's going to have the same relationship with calling the police as the next survivor. So, there's so many different components to it.
When you're going to work with your parishioners, like, we understand this is where people are going, and being able to identify when people's needs go beyond their scope. Praying isn't necessarily always going to work. It definitely can help you, but it's not always going to be what needs to happen.
We're seeing a lot of need. We're seeing a lot of people who are saying, we've been stuck in this home for, going on 3 years, and there's really no outlets.
And if folks are looking for therapists of color, it also makes it also extremely difficult. We have a lot of great people out here doing great things, but they can only do what they can do. And we need more therapists. We need more of color social workers.
Services that are in our communities, and whether or not they're functioning properly, right? Or are there enough? Because we keep hearing there's not enough providers. And where are these safe places for our children and adults to go who are experiencing the issue? When we look at that information, we look at those data and statistics together as a collective, then we can start to really create some substantial evidence.
This generation is more in tune because it's so much more awareness around the issue of mental health. They hear it on their TikToks. They hear it on Instagram. They see videos about it from their influencers. And I think if we adopt that same mentality, then that's more than half the battle in addressing the stigma. To your question, Dr. Patricia.